Hi everyone, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Today I want to talk to you about a condition which I often treat, and that is excessive sweating, which is also known as hyperhidrosis. Society's awareness of hyperhidrosis is slowly increasing, yet there still is a lacking of understanding of its profound impact on the quality of life in patients who suffer from it. Hyperhidrosis affects millions of people globally, yet many remain unaware of its existence and the implications. It is commonly classified into a primary and secondary form. Primary hyperhidrosis tends to occur without an underlying medical condition, while secondary hyperhidrosis is often a symptom of an underlying issue such as an endocrine disorder or a neurologic condition. Okay, so now let's talk about the causes. The causes of hyperhidrosis are not fully understood, but the condition is linked to overactive sweat glands, which can be influenced by genetic factors, hormonal changes, or a heightened emotional state like anxiety. So first I want to talk to you about the non-surgical treatments that we use. And the first is antiperspirants. And some of them are over the counter and some of them are prescription, but most of them contain aluminum chloride. Okay, and they have proven effective in managing symptoms for many sufferers. However, the results are often inconsistent, and it's a familiar frustration that many young people suffer from. The second class of drugs are anticholinergic medication, and these work by blocking the chemical responsible for activating the sweat glands. While some people have reported significant relief from symptoms using this approach, significant side effects may be a concern. The third is Botox. So the FDA-labeled use is a treatment of severe primary armpit hyperhidrosis that is inadequately managed with topical agents. And one randomized double-blind trial, 50 units per armpit or axilla, significantly increased responder rates versus placebo at 4 weeks, which is defined as a greater than 50% sweat reduction. And this occurred in 91% of the users versus 36% in placebo. So in practice algorithms, Botox or botulism toxin is positioned as a first or second line treatment for focal hyperhidrosis when topical measures are inadequate. And that includes axillary, like I just said, armpit, your palms or palmar, your bottom of your feet plantar, and craniofacial sites. As a thoracic surgeon, I have extensive experience using Botox in palmar and axillary hyperhidrosis with durability commonly greater than 4 to 6 months with meaningful quality of life improvement. The fourth is Miradry, and this innovative procedure destroys sweat glands using microwave energy and is particularly effective for underarm sweating. Clinical trials show that 80 to 90% of patients experience a significant reduction in underarm sweating, making it an appealing option for younger patients. So now I want to talk to you about surgical treatments, and we use these for severe cases that do not respond to other therapies. There are surgical options that are available and effective, believe it or not. The first is endoscopic thoracic sympathectomy, or ETS. And this is a procedure done by a thoracic surgeon like myself. And it involves entering the chest and cutting nerves that trigger sweating in specific areas. Although it can be highly effective, it comes with potential risks, including something called compensatory sweating, which you can sweat elsewhere in the body. And this weighs heavily in a lot of patients' considerations whether they should do it or not. The second is sweat gland excision, and this involves surgically removing the sweat glands in affected areas. And while again effective, recovery is often difficult and potential side effects must be taken into account. So with that, I hope you learned something today. Thank you so much for listening. For further guidance, medical advocacy, or to schedule an online consultation, please go to my company's website at www.paladinmds.com because it's like having a doctor in your family. And hope you have a great day.